Hello and welcome to Conversations with Dr. Westman. This series is brought to you by Adapt Your Life Academy, and today we're going to be chatting about thyroid. We also have a bonus for you. It's Dr. Westman's free 8 ways to kill sugar cravings. And we'll put a link for you in the description. How are things going, Eric?
Doing great. How are you, Glenn?
Very, very good. Thank you. Eric, we recently did an episode on hormones, and I must tell you, we got so many requests for doing an entire episode on just specifically the thyroid. So, Eric, let me start by asking you, what is the primary function of our thyroid gland?
Sure. So, of all of the different hormones that we have in our body, the one that's most important for regulating our metabolism, the metabolic rate or the idle speed of our body, is thyroid. So, the thyroid, which is a gland that sits in the neck, actually secretes a hormone that will regulate pretty much all the cells in the body in terms of how much they're going to, again, like the idle speed on a car, how much metabolism, how much burning of energy there will be. And so you can imagine that if someone is low in thyroid hormone, like a low idle speed on a car, they're not going to have much energy, not much get up and go to go very fast. On the other end of the spectrum, if you have high thyroid, you might feel like your idle speed is really high, like you're at a stop sign and your engine is still revving really high. That would be a high thyroid. But for weight loss and obesity and diabetes, generally the more common problem that we see is a low thyroid, and so it means you're not burning much energy. You might be lethargic. I mean, this is the most common type of thyroid problem we see, the low thyroid.
And tell me, does a keto or a low carb diet affect the thyroid? I mean, I know that you've seen so many people in your clinic over the last 15, 20 years. What do you see in your clinic in terms of thyroid and how it affects, how keto or low carb affects the thyroid?
Yeah, when we look at someone, evaluate someone at the beginning in a medical setting, your doctor may be checking these things. An obesity medicine doctor like me will always make sure that a thyroid level has been checked at the baseline. And so when people come to me, I have to say it's very rare for me to find a low thyroid level that another doctor hadn't already found. So other doctors are looking for thyroid, and then if there's no low thyroid, the doctor might say, well, I'm not sure what's going on, and then they don't give you any advice. So, that's one of the studies I'd love to do, where we take people before and after to see what happens to everyone's thyroid levels. But what's complicating about all of this is the thyroid level in the blood doesn't tell you how the thyroid function is working inside your cells. And this is a common source of confusion. The thyroid level might be normal in the blood, but it doesn't give the normal function inside the cells. Kind of like insulin resistance. You have a high insulin level in the blood, but insulin isn't working well. Sometimes the thyroid level doesn't really reflect how well the thyroid is functioning. So that can be confusing, but we always check the blood levels. If the blood levels are low or super high, then we know there's an issue. If the blood levels are normal, there still may be an issue, but it's just that the blood level doesn't reflect the problem is there.
Now, when you're doing your checks in the clinic, do you check for T3, T4, and TSH?
Yes. So in our area, well, in the US generally, the doctors have been taught that a thyroid stimulating hormone, or a TSH, is enough. And you have to understand the idea of screening in populations, and that if you ask every doctor to do a test, sometimes you will miss cases. And that's what screening is for. You don't necessarily have to have everyone to be caught in your net of screening. You want to just find as many people as you can. So most doctors don't do a full thyroid panel. which is the TSH, the stimulating hormone, the T4, and then the T3. And these are two thyroid hormones. They're just a little bit different. One's 3 and one's 4 based on the way the molecule is. And the main thing to know is that it's the T3 that's the most active form of the thyroid hormone. So that if the doctor, and I fall victim to this sometimes, if I quickly tick off the box of blood tests to check, the most common one is TSH and T4 now in our medical lab tests without the T3. And so there's a whole nother idea that doctors have been taught, well, if T4 is okay because we're giving thyroid in the form of T4 and the TSH is normal, then there's not a problem, when really the full panel, as a specialist, I don't want to miss anyone. So I'm not screening anymore. I'm trying to make sure that you don't have the problem. We're not just trying to see if you're at risk for it. So if you go to an obesity medicine specialist or a keto specialist, they're going to check the TSH, the T4, and the T3. In fact, it gets more complicated than that. If you've been on medication or you have symptoms and these levels are fine, then there are some antibodies that can be checked to see if your body has a reaction against the thyroid hormone. So this would explain why the thyroid level is normal, but it doesn't work right, because your body's actually fighting it with antibodies. So that's another level of testing that we can do to see way beyond just doing a TSH, or way beyond just doing a TSH and a T4. And most obesity medicine doctors, that's the organization I'm the past president of in the US, most of these doctors will understand that and do the full thyroid evaluation before they say, oh, you don't have a problem. But most non-specialist doctors will just do one of these tests and say, it's normal, you don't have a problem, when you still might.
Now, my experience or my understanding about the thyroid medications is that when somebody goes on some sort of treatment using thyroid medication, that it often takes quite a bit of time to get the idle speed correct. So there might be, you would prescribe a drug that would either raise the idle speed or lower the idle speed, and it takes a little bit of constant checking to be able to get that idle speed correct. And I know that certain factors can dictate how that plays out. For example, exercise, very strenuous exercise would mean that you would need to either take less or more of that medication.
Right. Well, so the first step is the proper evaluation for thyroid and getting that right. And then if you're introducing a treatment, then there are complicating factors, because the traditional endocrinologists in the US, the thyroid experts, almost insist upon using just one way of going about things. Where have we heard this before? That's a common thing where doctors and dietitians get into one issue and they just have that as the way to do it. So if you're on a medicine called Synthroid, which is a synthetic T4, remember T4 is not the active T3, so it relies on your body to convert the T4 to T3. If you're on a synthetic thyroid replacement like that, you want to be sure that these other ones, which have T3 and T4, they might actually help better. So that there's if you have symptoms and when you're on just a synthetic T4, you might get better relief of symptoms if you're on a what's called desiccated or dried thyroid, which has a combination of T4 and T3. And like you said, the change is not like if we use that metaphor of an idle speed, it's not like putting your accelerator down and then your idle speed goes up this fast. It's more like turning an ocean liner on the ocean. You change, and then there's a very slow, meaning a period of weeks where you see the adjustment to the medication for thyroid. And so yes, it's a slow response to a therapeutic change when you're treating someone with thyroid. I mean, so you can see that it's a kind of complicated area that most doctors don't get the deep dive into. They look at a test on the lab panel, and then they use one pill, and then if you still have a problem, they say, well, I don't know. It's all in your head, or some other kind of terrible thing like that to say.
So now, talking about T3 and T4, if someone has low T3 syndrome and their T3 level drops, what should they actually do?
Right. Well, of course, once you get into the testing, you want to make sure that it's not a there's called primary, secondary, tertiary problem. So there are different hormonal levels. You'll want to have a proper evaluation to make sure there isn't some sort of brain abnormality that is at the root cause of a low thyroid level. So let's say all of that is normal, and these are just blood tests, but the doctor has to know what blood test to check. If you just have the T3 low, then that merits replacement if you have symptoms. And that would mean, depending on whether you convert the T4 to T3 adequately in your body, you may respond to the Synthroid synthetic T4, or you might want the synthetic T3, or the combination of T4 and T3. And part of the issue is that most doctors get trained in just one way and don't know the nuances. And even as I got into this, there are some drugs, medications that are in milligrams, and there's some in micrograms, and there's some in the old grain thing that, 1 grain, which was kind of the old way of doing things before there were milligrams. And so you have to have conversion formulas, and at first I didn't want to take the time to learn all that. Of course I did, because thyroid is so important when you're trying to help someone lose weight or fix diabetes, and these endocrine problems tend to run together. So that if you have diabetes, you're more likely to have some other endocrine problem like low thyroid.
Speaking more about other functions of the thyroid, what role does body heat have in the thyroid?
Right. So that metabolic rate, the idle speed on the car, is what generates heat for your body. So if your thyroid is low, you may be cold all the time. One of the major symptoms is what's known as cold intolerance, which means you're colder when other people are warmer. The classic sign is when you're in bed at night, you think it's cold, you have more blankets than your spouse does, for example. Or you go outside and you're wrapped up when everyone else is not. So that's one way you can gauge it. And then, of course, energy level being a kind of metabolic and heat related thing, you would have low energy, low temperature with low thyroid.
I have a last question for you. And this is the one that's the important one. Is keto safe for somebody without a thyroid?
Yes. You want to be sure that you've had the optimization of the thyroid with medication if you've been on medication for it. But yeah, I think it is. In fact, a lot of people will respond favorably to the autoimmune type of thyroid problems, like Hashimoto's, will get better or improve when you take away carbohydrates in the diet. That's one of if you look on just a standard thyroid type of diet for Hashimoto's, they'll reduce the carbs, maybe not to the level of keto, but they understand that carbs lead to inflammation, can enhance autoimmune problems like that. No, I think keto is fine, even if you haven't had, if you have your thyroid taken out and optimized, if you've had other organ systems modified. I mean, all you're doing is changing the fuel your body uses from mostly carbohydrates that you were eating to mostly fat. So that, if you eat carbs, you burn carbs. If you don't eat carbs, you burn fat and ketones. So that, to me, when you take away the language, the term, button of keto, no, all it is changing the fuel your body uses from mainly sugars and starches to mainly fat. So it's going to be good even if you don't have the thyroid.
Eric, thank you so much. Again, fantastic information that you've given us today. That's all we have time for today. But for you guys, don't forget about the bonus. It's Dr. Westman's free 8 ways to kill sugar cravings, and we'll put the link for you in the description. If you'd like to learn more about Adapt Your Life Academy and our upcoming courses that we're running, we've got some new courses that are going to be launching in March. You can find us on adaptyourlifeacademy.com. And if you would like to find out more about other channels where we have a lot of other free content, you can find us on our Instagram, Twitter, YouTube, and Facebook channels under the name of Adapt Your Life. Eric, I really appreciate your time once again, and we look forward to chatting with you next week. Until then, we'll chat next week.
If you like this video, you're going to love our Adapt Your Life Academy. So click on the link in the description to find out more.